Good morning, my name is Caitlin Klein and today I'm going to be performing a newborn assessment. So before I come into the room, I'm going to wash my hands and perform the necessary hand hygiene that I would do before I started. And when I get to the baby, I'm going to check their ID bands. So this baby is RNNBNN. So that's the baby today I'm going to be performing my assessment on. First thing that I'm going to do, I'm going to check the vital signs of the baby. So I'm going to unwrap the top half of the baby, unbutton its shirt, to check the temperature. The temperature, it should be an axillary temperature. So I'm going to put my probe on and I'm going to put the thermometer snugly in between the infant's armpit. Next, this can take a while for the temperature to read, so while I'm waiting for the temperature, I can put my hand on the baby's chest and count the respirations for a full minute. This is something that you can typically do first, so when you're doing your assessment, checking the respirations and temperature first is something you can do before, because you've just uncovered the baby, so the temperature should be still fairly normal, and then respirations you want to check before the infant becomes startled. So regular ranges for a temperature is 97.5 to 99.5 Fahrenheit. And for respirations, it's 30 to 60 minutes. Next, I'm going to listen to some heart sounds. I'm going to check the apical pulse of the baby for a full minute. And normal ranges for a pulse would be 100 to 160 per minute. And while I have my stethoscope in my ears, I'm going to check the breath sounds bilaterally. So anterior, you can check right above the nipple line, and for lower lobe sounds, you can go underneath the armpit, pits of both lungs. For another place, you can check your breath sounds. And you may hear some fine crackles in your breath sounds, but this is just due to some possible leftover amniotic fluid. Next, I'm going to check some heart tones, too, to make sure the heart tones are regular. Make sure there's no murmurs or anything like that. Then I can also check bowel sounds in all four quadrants. Bowel sounds should be active, and if anything wasn't active, that would be an abnormal finding that you could report to your nurse. Okay, so I'm going to kind of cover the baby up here. First, I'm going to check the baby's head. So first I'm going to remove baby's cap. I'm going to check for molding of the head. Molding is when the head can be kind of cone-shaped, and that can occur right after birth. But molding should go away, or the baby's head should start to take its normal shape a few days after birth. Next, I'm going to check the fontanelles. There's the anterior and the posterior fontanelle. The anterior fontanelle is the largest fontanelle, and it's on a diamond shape on baby's head. And then posterior should be a triangle on the back of baby's head. Also, I would check the suture lines. And then if there were any masses on baby's head, a cephalohematoma, it's a blood-filled mass. And a cephalohematoma is different from a caput succedaneum because the cephalohematoma does not cross the suture line. If there is a fluid-filled sac that were to cross the suture line, that would be caput succedaneum. Okay, next I'm going to check baby's eyes. Baby's eyes should be, the face should be sectioned into thirds. So the eye should take up a third of baby's head, each eye. So in the center. I'd also check any baby's eyes for any hemorrhaging or any, I would also check the epicanthal folds of the baby's eyes. Epicanthal folds, they can differ when baby's race or ethnicity, so babies that are Asian, their folds would be more prominent than it should be in Caucasian babies. Next, I'm going to check the ear placement. So you're going to draw a line from the corner of baby's eye straight across, and that's where your ears should line up on both sides. To check the cartilage of the ears, you should fold the ears down, and then they should recoil instantly, and that should be a normal finding in a term baby. Next, what I'm gonna do, I can put baby's cap back on since I'm done checking its head. So make sure his head stays warm. But I'm gonna check the nasal patency. So I would cover one nostril and put my other finger close to the other nostril to feel baby's air come out and see how well nasal patency is in the baby. To check the mouth, I would put a glove on. And I would put my finger in the mouth and feel for the palates, make sure they are both there and intact. And also I would check baby's sucking reflex. So the baby sucking is a normal reflex for the baby. So if the baby sucks on my finger, that is something that should happen once I put my finger in baby's mouth. So I would discard this glove. Next I'm going to check baby's neck. To check baby's neck, you can put 2 fingers along the side and go down the neck, feeling for any masses on baby's neck. You would also check the range of motion. So I gently turn baby's head from side to side to check range of motion of the head. Next I'm going to check the clavicles. We're checking the clavicles to make sure they are even and that they are not in any, baby isn't in any pain when I touch the clavicles, and we want to make sure they're even. When also checking for when baby is breathing, you want to make sure there are no signs of respiratory distress. Respiratory distress signs include apnea, nasal flaring, grunting, retractions, and periods of apnea, because babies can have a period of apnea up to 20 seconds. Also, I would check the abdomen of the baby, would palpate it, and it should be soft and not distended. While I'm doing all these assessments also, I'm checking baby's skin. I'm checking for signs of languo, which is like downy hair on the baby, any bruising or scratches, or just any abnormalities or birthmarks that we can find on baby. I'd also check for signs of jaundice on the baby. So we could check for signs of jaundice on the forehead. You would blanch the forehead with your finger, make sure there's no yellow tint. Then you can check the sclera of the eye, the inner thighs, and the chest. Okay, next what we're going to do is we're going to check baby's genitalia. So we'll uncover baby. We have a male baby. So what we would want to make sure, the penis and scrotum are prominent. And we would also want to make sure and check, you would put gloves on before you would check baby's genitalia. Get my gloves on. Check baby's genitalia. You also want to make sure the baby's testicles are clearly distended, and you can check that by placement and position of the testes, or you can also put your finger on the inguinal canal, kind of push down a little bit, and that's also another way to make sure that they're fully distended. You want to make sure the urinary meatus is at the tip of the penis, and you want to check the testicles for rugae. Term babies have well-developed rugae along the testicles. For a female baby, you would check to make sure the labia majora is prominent over the clitoris and the labia minora. But you would also check the female baby for any signs of discharge. Discharge can be normal as long as there's no, a little bit of white bloody discharge can be normal if there's no signs of odor or just infection or anything, and that's just something you would wipe off. So when we're finished with baby, we would also check to see if he had any stool or if he voided. We would take note of what he did, and then we would change and put a fresh new diaper on baby. I don't have a fresh new diaper for baby, so I'm just going to go ahead and put this back on. Okay, next what we're going to do, we're going to check palmar creases on the baby. And all the digits. This baby looks to have all of its digits, and none of them are webbed together. You also want to check the palmar creases because no palmar creases can indicate prematurity, and a single palmar crease can be a sign of Down syndrome. We're also going to check all the digits and the palmar creases on the feet of the baby. Once again, baby's palmar creases should at least be over the anterior 2/3 of the foot or all over. Anything other is slightly abnormal. Another thing that we're going to do is we're going to test the Babinski reflex of the baby. What we're going to do is you can take your finger or like a dull object and you go in a backward J along baby's foot, and the toes should fan out. So if the toes don't fan out, that's something abnormal. You could report to your nurse. Next, what we're going to do is we're going to turn baby gently on its tummy. And we're going to check the spine of the baby. We're going to trace our finger down. And we're also checking the skin of the back. And then next what we're going to check is hip placement of the baby. The hip should be even. You should make sure that one leg is not longer than the other. And then also that the hips look even across, and you can check the gluteal smile of the baby. That's another indication to say that hips are in place. At the bottom of the spine, there should be no dimples or hair or tufts. That is typically an abnormal finding in baby. So we're going to turn baby back over. Next, what we're going to do is we're going to check the Moro reflex. So what you're going to do is just hit the side of the table that baby's on, and baby should lift its arms and kind of make a C with its hands. And then another reflex that you would check for baby is baby doesn't have any joints, so I can't show you on baby, but you would lift the baby's arm up, and then you would apply some resistance and hold for a little bit, and then it would recoil. That would be a typical normal arm tone in a baby. So we're going to wrap baby back up. You would also know baby's behavior throughout this assessment to make sure tell if the baby was crying, if the baby was calm. And then you would also check when the baby had stool and voided, and you would check when the baby is next due to feed. And then also you would report any abnormal findings immediately to your baby nurse, the mother baby nurse, your mentor nurse, or the nursery nurse. And that is my assessment.